Hello, my name is Thomason Propson, and I'm a benefit specialist at the UW-Madison. This is a recording to describe new employee benefits offered to our grads, fellows and scholars, short-term and part-time academic staff, and postdocs with the benefit year of 2024. Everything that I'm recording today is happening in January 2024, and it is accurate as best as I understand it. Please reach out to my office if you have any questions about what I've included in today's session. This presentation is specifically for our UW-Madison employees or scholars and fellows who are eligible for the grad benefit program. That means you may be a TA or an RA here on a scholarship or a fellowship or holding a postdoc employee in training appointment, or you may be a short-term academic staff or faculty member who is eligible for this benefits program rather than the Wisconsin retirement system. If you're not certain whether this recording is for you specifically, double check with your own local HR and they can assist you. Just a quick note for those of you who may be short-term or part-time faculty, academic staff, or limited appointees not currently eligible for the Wisconsin retirement system, take a look at the next few slides that will be in this section on the copy of slides that we have available on our website, because they give you special information about what to watch for to see whether you will in the future become eligible for the WRS. It's very important to understand WRS eligibility because it could change and you don't want to miss your opportunity to enroll in WRS benefits. They are still limited to a 30-day window. So talk to your HR office, take a look at these next few slides if you're fastly not yet eligible for the WRS. I just wanted to mention that. By the end of this session, you'll better understand your enrollment deadline, which is a 30-day window from your start date through the date by which we have to have received your decisions. We'll review the 2024 benefit plan options, and you'll better understand how to read more detail about each of the plans. And you'll know how to send your decisions to us, whether you're waiving or enrolling in the various plans. I'll spend much of my time today on health insurance, since that's the largest plan and the one that has the most interest in most cases, but I'll also talk about life insurance as one of our potentially now or never enrollments. So it's important to consider carefully life insurance when you're a new employee. And then we'll wrap up with the supplemental plans, such as dental and vision, retirement accounts, and flexible spending programs. My office and our website is the hub for the benefit information. So if you visit us at hr.wisc.edu/benefits, you'll find the written documentation for the information I'm discussing with you today. And you're always welcome to reach out to me and my office at our email address, benefits@ohr.wisc.edu. You will also want to get to know your local HR contacts. So whenever you have questions about payroll or taking time off or even initial benefits questions, your local HR can assist you. And if you're not certain whom that might be, you can visit our website, hr.wisc.edu/contact, and identify your school, college, or division and whom in your office would be the primary HR contact for you. It is also very helpful if when you're reaching out to my office, you provide us not just with your name, but also with your employee ID number. Sometimes we call those the EMPL ID. This is a randomly generated number that is assigned to you and you alone. It is not your social security number, nor is it your WISC card number. So it is a completely different number that we use to find you in our payroll and benefits system. A tip could be to take out your WISC card and actually attach or write onto it your employee ID number so that you have it with you whenever you reach out to my office and can just tell us your number specifically so we know how to look you up in our system. Your school, college, or division's website is where you will visit to find organizational charts, contact lists, and other unit-specific policies that you'll need to know to do your job here at the university. You'll want to know whom to ask for time off or to let someone know that you're ill or other basic leave and payroll and benefits questions. So visit our website if you're not certain whom your HR contact will be to ensure that you know who it will be when you need to reach out. And then my office offers the benefit detail that you'll need today and in the future to make wise benefits decisions. So our website has the various details and brochures about all the plans we're discussing today, as well as others. And you're always welcome to reach out to my office if you have questions about what you see on our website. One of the primary resources I would encourage you to use as you're deciding what your new employee benefits elections should be is the State of Wisconsin's Health Benefits Decision Guide. This is a brochure that you can look up online, and it offers you a comparison of the different health insurance plans and how they work, as well as the price you will pay depending upon which of the plans you elect. It also provides you with the overview of the dental, the vision, the accident insurance plans, and the costs for each. So it's a good resource to use as you're getting to know your options. You also may want to look at the Universities of Wisconsin resources. You'll find those on their website, wisconsin.edu, and you'll find their university-specific quick guides and summaries that include some benefits that weren't on the other state summary, because some of your benefits are offered to you simply because you're a UW employee, not because of your connection with the state. And there is a helpful benefits walkthrough program that you could use if you're interested in exploring what the total cost of the benefits you might want to elect could be. That benefit walkthrough doesn't enroll you in anything, but it does allow you to pretend to enroll in the programs in which you're interested, and then it gives you an idea of the monthly premium you will pay if you do end up electing all of those. Now, for your deadline, you have 30 days from your start date of your benefit eligible appointment to decide on which of the plans you want to enroll into and which you want to waive out of, and then make your decisions known to my office. It is as simple as grabbing your offer letter or the email that notified you of when your start date might be, and then counting on the calendar 30 days from that date. We have to receive your decisions by that 30th day in order for us to honor them and be able to process them as timely new hire elections. The plans that are being offered to you are many, and so you'll want to, before you make any decisions, review all of the options and think carefully about the coverage that you need now for the rest of this year of 2024, as well as what you might need in the future going into 2025 and beyond, because there are many options and your needs might change during the course of your employment. There are 3 types of plans that offer you very flexible enrollments and then changes to initial elections. And those are this UW's Accidental Death and Dismemberment Policy, which we call AD&D for short. Also, the retirement plans being offered to our employees and the pre-tax parking being offered to our employees allow you to join and participate and then pause your participation during the course of your employment. So these are very flexible. You can join and then pause your participation in them easily. Most of our plans, however, have a specific window during which you could enroll into them or officially waive out of them for a full year. And you can make mid-year changes only if there is a qualifying life event, like a marriage or the birth of a child, and that then you notify us of those qualifying events within 30 days. Otherwise, you may have the opportunity each fall to make changes to health, dental, vision, accident insurance, flexible spending accounts during our fall annual enrollment period for the following calendar year. So today's presentation is focusing on 2024 benefits, but each fall in the future, while you're our benefit eligible participant, you'd have another opportunity to make changes to these certain benefits for the following year. Just a quick note about qualifying events. Different types of life events that occur to you will affect benefits in different ways. So your opportunities after a loss of health insurance coverage could be different than your opportunities after the birth of a child or after a relocation of your home address. Double check on our website for the types of life events that could affect your benefits, and reach out to your HR office if you have any questions about those changes and how they may provide an opportunity for benefits changes. I also have, as part of the slide deck that is uploaded to our website, some specific slides for international employees who may have families not yet here with them in the US and are wondering when they should add their families to their insurance plans. And also a slide for employees who may not yet be 26 and who are currently under their parents' insurance, But in the future, when they do turn 26, they wonder what will happen to their benefit opportunities at that time. Check out those slides as part of the deck that is loaded onto our website. Now, there is a type of insurance, life insurance, that may be offering you a new enrollment opportunity while you are now a new employee, but may never offer you this opportunity again. And so our individual and family life insurance, which is a policy offered to you by the UW, offers you this open enrollment within your first 30 days as our benefit eligible employee, but it is not easy to enroll into in the future. So we will just discuss that a bit after I talk about health insurance. I'll talk about this life insurance plan so you can think carefully about it and decide whether you want to enroll or not as a new hire. Once you have made all of your decisions about the various plans, you'll alert us of your choices by logging into your MyUW portal using your NetID and your password. You'll then visit the benefit information tile and click on the Enroll Now button that's in the middle of that box, and that will take you to an online enrollment portal that initially shows that you've waived all the benefits, so you go in and actually make updates to each if you choose to enroll in one or the other or multiples. There are other links on that same benefit information tile that take you to additional information, and that could be useful in the future. But for the enrollment, you hit the Enroll Now button. Now, if you see the benefit information tile, but you don't have the Enroll Now button, that likely means that you need to complete and hand in paper applications or fill out, on your computer a PDF form and then email it over to your HR office. This is common if you have previous service with the university, and definitely it occurs if you have previous WRS history. So in those cases, if you don't see the Enroll Now button, just fill out paper applications and turn them in. We still have to receive those forms by your 30-day deadline. If you do find that you don't have the Enroll Now button and you need to submit paper applications, note that each of our insurance plans has its own application form. So there is a form for health insurance, there's a separate form for vision insurance, there's a separate form for flexible spending enrollments, there's a separate form for did I say life insurance? They all have their own forms, and you'll find each on our website on each benefit specific page. There will be at least one form that we'll need back from you, even if you're waiving all of the paperwork. If you have to submit paper to us, we want the health application back, even if it's simply to note that you are choosing to waive the coverage. Otherwise, if you are submitting paper or emailing PDF versions of the forms and you're waiving other plans like supplemental dental or vision, then you simply don't submit to us those applications and we know you've waived by default. When your insurance plans will begin depends on a few things. It depends on the receipt of your application, making sure that we did receive it within your first 30 days. It also depends on your start date itself and the type of employment you hold, and then the type of insurance we're talking about. Most of us are most concerned about health insurance, so I'll start with that one. Health insurance is effective the first day of the month following your date of hire, or the first of the month itself if your start date was that first day of the month. So in the example on the screen, we show an employee whose start date was January 4th, and if that employee signs up for health insurance within their, by their 30-day deadline, then their health insurance would begin February 1st. Something similar is true for most of the other supplemental plans. So the accident insurance, the dental, the vision, and the flexible spending accounts, they are effective the first day of the month following your date of hire, or the first day of the month itself if that was your first day. Again, in the example on the screen, if an employee started on January 4th, then enrolled into vision insurance, their vision would be effective on February 1st. Accidental death and dismemberment and the life insurance plans are a bit different. They are not in effect until the first of the month after you've completed 30 days of eligible employment. So in the example on the screen, with a date of hire of January 4th, this employee's benefits wouldn't be in effect until March 1st. Once you've made your decisions and submitted them via the enrollment portal, you'll receive a confirmation statement notice within a day or two. Go back to the MyUW portal, view the confirmation enrollment statement, and make sure that it is accurate. If you've since changed your mind about any enrollments or waivers, or you see an error, reach out to your HR office and my office immediately, because as long as we're still within your first 30 days, we can provide you instruction on how to make corrections to the benefit elections. If you have to submit paper applications, there is a bit of delay between when you submit the information and when it will actually show up in our system, because we have to take those applications and manually process them. But keep an eye on the benefit information portal, and once everything is entered, you'll be able to see it on your summary page, and you'll begin to see deductions coming out of your paychecks. So speaking of paychecks, there are these printouts called earnings statements that you'll find online in your MyUW portal that give you a review of your pay periods and how much money you were paid and how much was sent to your direct deposit accounts, how many hours that for which you are being paid and the rate, as well as it will show any deductions that were withheld from your pay for any of the insurance plans that you elected. So all of our insurance plans have a cost to you if you were to enroll in them, and their cost will be withheld from the pay you're receiving from the university. So you can track those deductions through your earning statements. We at the university are paid bi-weekly every other Thursday. And you can expect, depending upon when your date of hire might be, that your first pay date could be several weeks after your start date for your first week or two of work. Your insurance premiums will again be withheld directly from your pay through the university, and we pay for our insurance 1 month at a time in most cases. Your insurance premiums for a month will be divided between 2 paychecks of that month. You pay for the first part of that month's coverage from the first paycheck you receive that month, and then you pay for the second half of that month's coverage from the second check you receive in that month. So to give you an example of coverage in January, those of us who are employees in December or earlier, and we are expecting coverage for January, we would pay for that January coverage from the first 2 checks paid to us in January. So on January 11th, we paid for the first part of January's coverage. And then on January 25th, we'll pay for the rest, the second half of January's coverage. For February's coverage, you would initially pay from the February 8th paycheck, and then for the rest of the month from the February 22nd paycheck, and thereon throughout the rest of the year. Next up, I have details about the health insurance program, and we have more detail than I can share verbally on our website. So check out hr.wisc.edu/benefits/grad to find kind of a visual of this slide that you see here. Each of these is a hyperlink once you get to our website that takes you into further detail about the plans. But the price that you'll pay to enroll in health insurance, and then the doctors that you need to visit to use the insurance, the types of services that are covered by the insurance, and what your portion of the cost of services will be, depends on which of the health plans you elect for the coming year. There are 2 different health plan designs. One is a traditional kind of small HMO style plan, and it is in general called the IYC, or It's Your Choice health plan. Within it, if you're choosing that design, you'll choose a smaller group of doctors to be your doctors for the coming year, and then you'll visit only those doctors unless it's an emergency. If you were choosing that health plan and you went outside of your chosen group of doctors, and it was not an emergency situation, then the insurance will not cover those out-of-network services. Alternatively, there is the Access Plan that offers coverage for doctors throughout Wisconsin as well as throughout the entire nation. And it further allows you to even step outside of the network to visit doctors that have no part of the Access Plan directly. And it still allows a certain amount of coverage for those out-of-network services. And so coming up here is how I'll describe what it looks like to participate in those plans. Just a note on perhaps worst case scenarios, what you might expect if you need multiple surgeries and many prescriptions during a year. Under both the health plan and the access plan, if you're seeking in-network covered services, then your medical expenses at most would be $1,250 per person per year. If you have a family plan and multiple people in your family are all receiving office visits and surgeries and medical equipment, then at most the family might pay up to $2,500 per year. But again, no individual would owe more than the $1,250 for their in-network covered services. Slightly separate are the out-of-pocket limits for your pharmacy benefits. If you're filling through a in-network pharmacy, picking up level 1 and level 2 prescriptions, which I'll describe coming up, then at most you would spend $600 on those prescriptions per person per year. Again, if you have a family plan and multiple people in your family are all filling level 1 and level 2 drugs, then at most $1,200 would be your family's total expenses for prescriptions for the year. On the higher end of cost, if you need to fill more specialty drugs that fall into the level 3 and level 4 categories, there is still an out-of-pocket limit, but it is much higher. It could be as much as $9,450 per person, up to $18,900 per family. Few of our employees ever need level 3 or level 4 drugs or reach that maximum, but it is possible that you fit into that category. And just so you know, there is a limit even to those more expensive specialty drugs, the $9,450 at most per person per year. All right, with the health insurance, the election that you make for health insurance can be just a plain health enrollment, or it could be health of your choice and dental. And if you choose the health and dental election option, then this preventive, called uniform dental plan, is what you would receive attached to your health enrollment. It means you're paying an extra $3 a month on top of what you would have spent on health if you have a single plan, or an additional $9 per month on top of what you would have spent for health if you have a family plan. But then it provides you or your family with this preventive dental insurance that allows you to have twice a year routine cleanings and exams. Your children can have the fluoride treatments they may need. Your children could also have orthodontia coverage. The coverage is run through a company called Delta Dental, and their group number and contact information is on this slide. So if you wanted to reach out to Delta and ask them about this uniform preventive dental insurance, they would provide you with details on its coverage. So the price you will pay for your monthly health insurance depends then on which of the health designs you elect, whether you want the Wisconsin-based health plan or the nationwide access plan. And then it also depends on whether you want coverage just for yourself as an individual, or you also want to extend it to members of your family. And a family could be you and a spouse, it could be you and a child, it could be you and your spouse and multiple children. It's just more than simply you. And then whether or not you attach that preventive uniform dental to your health election also affects the monthly premium. So you can see on the slide here, if you chose one of the Wisconsin-based plans just for yourself with the preventive uniform dental attached, it would be $59 a month. Or if you wanted the family version of that same coverage, it would be $148 per month. The nationwide coverage, on the other hand, with both of its in-network and out-of-network allowance, is more expensive. It would cost you $136.50 a month if it's just you on the plan, or it would be $341.50 per month if you're covering family. Many of our employees live and work right here in Madison, here in Dane County, and so many of our employees choose to elect one of our local Dane County networks. If that also meets your needs, then perhaps you would choose either the Dean Health Plan or the Group Health Cooperative of South Central Wisconsin's Dane Choice Network, or the Quartz UW Health Network. Each of those three offers doctors right here in Dane County in the Madison area. And there are various maps and brochures that you can read about these various three networks. Dean Health, for example, you can see on this map that they have doctors throughout Dane County as well as other parts of southern Wisconsin. The GHC Dane Choice Network has doctors right here in Madison, as well as other locations across Dane County. And the UW Health Network has doctors here in Madison as well as across Dane County. So you can learn more about those Dane County-based networks or other counties via Employee Trust Fund's decision guide or using their health plan search webpage. I do encourage use of the webpage. It's useful, it's interactive. You can click on the different plan design names and then find out their phone numbers and see their website addresses so you can search for doctors directly online with them. I'd listed again the Dane County network areas, but you might be more interested in doctors that offer networks in Sauk County or in Columbia County. So you'll want to go and visit the decision guide or the health plan search to ensure that you're choosing the right network for yourself and your family based on where you live, where you plan to seek services. And then a quick note about our Wisconsin-based plan. If you happen to live in an area just outside of Wisconsin, or you have family whom you want covered by your insurance and they live just outside of Wisconsin, maybe in the Twin Cities, for example, there could be a Wisconsin-based plan that extends its coverage over the borders into those surrounding states and would allow you then to elect the less expensive Wisconsin version of our health insurance rather than having to elect the nationwide plan. So take a look at Employee Trust Fund's health plan search webpage and learn more about how these networks could extend over into the UP, into Northern Illinois, into Eastern Iowa, or into Eastern Minnesota, and see whether they might meet your needs. Otherwise, if you do need the nationwide access plan, it is offering you a network here in southern Wisconsin through Dean, or you can see doctors across southern Wisconsin and northern Wisconsin and the rest of the nation through the First Health Network. And even if you went outside of those two networks, you still have some services and coverage. It's just more expensive if you happen to go outside of the network, but it's not banned. So you do pay the additional cost to be part of this very flexible plan. However, it is more expensive to be part of than the Wisconsin-based version. So to decide which of these plan designs are best for you, which network you should choose to be your doctors for the year, you'll want to do some research. Check to see whether your current doctor, if they're in the area, might be part of one of these plans versus another. Or if you're starting over, you might simply look to the different networks and ensure that you choose one that has locations or hospitals that are easy to visit, that are within your travel distance. You might also make the choice based on their telemedicine capabilities or which hospitals they would send you to if you needed surgery. All of those could help you whittle down to the best choice for you for the coming year. Now, should you enroll in one of our health insurance plans and you visit your network providers for your routine preventive care, that routine preventive care is covered 100%. And there are certain services that are considered preventive based on your age and your sex, and you can review those details on the healthcare.gov website. We also have further information about that preventive care in our schedule of benefits. And this is a document that you can access through the state of Wisconsin's Employee Trust Fund website, and we have links to it through our website as well. Now, if you need to seek care that is not preventive, this is where you'll want to understand the office visit copays, the deductibles and coinsurance amounts that could be required of you, as well as the out-of-pocket limits over which you wouldn't have to pay. So with the health plan, again, you're choosing, if you're making your election, an actual group of doctors to be your doctors for the year, and you stay within that group of doctors. If you go outside of it for a non-emergency situation, you don't have insurance coverage. The Access Plan, on the other hand, has their nationwide network, but you are allowed to step outside of it if you want to and still have some coverage. Under the health plan and the access plan, if you're visiting in-network providers, again, your preventive primary care office visits are covered 100%. But if it's for a visit with your primary care provider and it's not preventive. It's something that is ailing you. You know, you have headaches and you're visiting your general provider to talk to them. Or your child has complained of, you know, ear pain and you're going to see their pediatrician. Or you're suffering from anxiety or depression and you're going in for a mental health consultation or a chiropractic adjustment. Those primary care office visits will cost you $15. If you're visiting a specialist for an office visit, the copay is $25. And if you do need to visit the emergency room, then as part of the emergency room bill that you'll receive later, if they hadn't admitted you to the hospital, you'll also have to pay a $75 emergency room copay. To give an example of what this might look like, if I were to have a headache often enough that I made an appointment with my general doctor to discuss it, and during that consultation, I should back up. While I arrive for my visit at the front desk, as I'm checking in, they would likely ask me through this plan to pay my $15 office visit copay right when I'm checking in. And then should I go in and consult with my doctor and she recommend that I take different at-home allergy pills or change my pillowcases to try to alleviate my symptoms and then, sends me on my way, she may charge $100, $200 for that consultation, but I paid my share when I paid my $15 office visit copay. The insurance company would take care of the difference in cost. Similarly, if I were visiting an urgent care clinic because I had cut my hand while cooking and I couldn't get into my general provider immediately, so I went to urgent care instead, the consult that I'm receiving from them would cost me $25 as part of that visit to visit the specialists who are in charge of that urgent care clinic. But sometimes you need more than just a consultation. So when you need more than just a discussion with your doctor, when instead you need x-rays or diagnostic labs or surgical procedures such as the removal of a mole or an actual surgery upon your heart in the hospital, those types of services are run through your annual deductible, and you pay the first of their cost every year, as much as $250 per year. So with this coverage, to give an example, if I were having my headaches and I went in to visit my doctor and paid the $15 for the consult, and then my doctor thought that I should have an MRI to check things out in there, then when I had that particular service, that might cost more than $1,000, also including the radiologist viewing of the films that were taken. And my share of that cost would be $250 upfront. Well, I say upfront, but it would be part of the bills that you're receiving usually. And then for the remainder of the bills, for your x-rays, your MRIs, your diagnostic labs, your surgeries, the remainder of the bill after you've paid the initial $250 will be 10%, and the insurance company will pay 90% of the remaining bill. Or if it weren't a procedure, but were instead equipment, like durable medical equipment, like a brace for an arm, then you would pay 20% of the cost of that equipment, and the insurance company would pay 80%, up until you meet your out-of-pocket limit for the year. And again, that medical out-of-pocket limit is $1,250 per person per year. So that $1,250 includes any of the office visit copays that you've incurred, whether they are the $25 specialists, the $15 general practitioners. It would include the $250 medical deductible, and then it would include any part of the 10% or the 20% coinsurance that you may have been required to pay. But at most, for those in-network covered services, your share of the cost would be $1,250 per person per year. Slightly separate are the pharmacy benefits. Now, regardless of which of the health plans you choose to elect, your prescription drug coverage will be through a company called Navitus. And Navitus has a formulary on Employee Trust Fund's website that gives you a list of the drugs that are covered through the insurance program. And it also lists how they are covered, what level of coverage they offer. So you can find that formulary on ETF's website. And when you're reviewing the formulary, You can check for the names of the drugs that you regularly fill. Some of them may be listed as preventive, which means that when you fill those at the pharmacy, you pay nothing for them. Often contraceptives fit into that category. Other drugs may be listed as a level 1, and they would cost you $5 when you filled them at the pharmacy. Others would be level 2, and you would pay 20% of the negotiated cost for that drug at the pharmacy, but never more than $50. That would be at most what you would pay for a level 2 drug. If you do need to pay for the more specialty drugs that fall into level 3 and level 4 tiers, then those are more expensive. The level 4s need to be filled through the UW specialty pharmacy or with Lumicera. Level 3s, you pay 40% of the cost of the drug up to $150, and you pay the difference in the cost between that level 3 drug and its less expensive alternative. So those can be much more expensive. Check in with Navitus if you see on their formulary that you anticipate filling a level 3 or 4 drug, and they can provide you with more information and some cost-saving advice. Again, the pharmacy benefits themselves also have their own out-of-pocket limit. And for level 1 and level 2 prescriptions, that is $600 per person per year. If you have spent that much on level 1 and level 2 drugs for your own self for the year, then for the rest of the year when you're filling drugs at the pharmacy, the insurance company will pay for their cost. And level 3 and level 4 drugs are not capped until a much higher limit is met, as much as $9,450 per person per year. But that would be the worst case scenario when you're filling covered in-network prescriptions at your pharmacy. Also with Navitus are vaccinations offered for free at in-network pharmacies, and that can save some money over having to make a doctor's office appointment to receive a vaccination, where you'd also pay then the office visit copay. So receive vaccinations at your pharmacy for free. And this slide gives you an overview of these plans and how we just described them. So your in-network coverage, when you're filling your covered drugs at your pharmacy, you'll pay a copay of $5, maybe $50, or a percentage of the cost of the drug, whether that's 20% all the way up to 40%. And there could be a moment in the year, if you meet that tier's out-of-pocket limit, that then the insurance begins to pay for the rest of your prescriptions that year. In the meantime, if you're having office visits, then you pay either a $15 or a $25 office visit copay, or that could be $75 at the emergency room. If you need x-rays, durable medical equipment, diagnostic labs, and surgeries, then you pay the first $250 of those expenses incurred each year. And then the remaining bills are split between you and the insurance company, where you generally pay 10% of the additional medical cost, and the insurance covers 90%, until you have potentially been billed for as much as $1,250 for your in-network medical care for the year. At that point, the insurance company pays for the remainder of those covered services for the year. And our year begins each January 1st and ends each December 31st. So the coverage resets every January 1st. And that would be true for you as well, even if you're watching this video and coming into our coverage late in 2024. So even if your coverage isn't beginning until September 1st or November 1st, this year will still reset come January 1st, 2025. Now let's talk about out-of-network coverage. Under the Wisconsin-based health plan, if you step out of network and receive medical care, the only services that will be covered for you through the insurance will be for emergency and urgent care. So don't go out of network unless it's an emergency or an urgent health need. Examples of emergencies will be services or care that you need in order to save your life or to save a limb. So those would be, severe asthma attacks, convulsions, severe bleeding, heart attacks, and strokes. You need immediate care to save your life. Go to the nearest emergency room, or if you can, visit your in-network emergency room. That's even better, but certainly seek the care you need to save your life. What are not usually emergencies are milder situations when there are fevers without rash, sore throats and ear pain, most headaches. In those cases, you would want to give your primary care doctor's office a call and perhaps set up a visit with your primary care provider. In certain cases, it might not be an emergency situation, but you still need care more urgently than can be made through an appointment with your doctor's office. In that case, visiting an urgent care clinic is ideal. Most broken bones and sprains and burns can be treated at local or urgent care clinics. If you're visiting a clinic for urgent care, if you're in your general provider area, you do need to travel to your in-network urgent care clinic in order to have coverage from the insurance company. If you are traveling and away from your local area, then you could go to that out-of-network urgent care clinic to receive the urgent care that you need and still have it run through your insurance. But that's important. If you're in your general home area, visit only the in-network urgent care clinics in order to have your insurance work for you. There are additional resources on how to learn about where to seek the care you need, whether you want telemedicine services or whether you need to go to the ER at the hospital. Employee Trust Funds has a nice video that describes how to seek the care when you need it quickly. And you'll also receive information from your insurance company once you sign up for your benefits, and can always call them if you have questions about where to go if you need care quickly. Now, for the access plan, it is more forgiving if you step outside of its network. It does not require it outside of network to be only for emergency or urgent care. Instead, you can just step outside of the network for non-emergency care completely if you would like to. However, the cost will be more expensive to you if you do that. So you'd pay the first $500 for those out-of-network expenses that you incur, and then you pay 30% of the remaining bill, up to $2,000 per person per year. So you're allowed to go out of network for any reason, but it is more expensive when you receive care out of network. There are more details about seeking emergency care, and there are details about what is considered, an in-network versus out-of-network provider, as well as just details about the services that are covered versus the services that are excluded from the state's health insurance. And that detail is listed in the plan's certificate of coverage. I would encourage you to review the certificate and get to know your health insurance plan so that you understand what to do when you are in fact in need of care. And before you make your decisions about the coverage, you likely have questions that you need answered. So you may visit Employee Trust Fund's website and search for the care that you need based on the location in which you'll be living and seeking services. You may also reach out to the health plans directly to ask questions of where their clinics are located and where their hospitals, are located. ETF has a nice frequently asked questions section of their website. So if you have a question in your mind about health insurance, likely someone else has had a similar question, and reading through that FAQ can provide you with the answers that you need. So just a quick review. In order to choose the health plan that is best for you, think carefully about which of the plan designs will meet your needs. Will you be satisfied with a Wisconsin-based plan where you choose a small group of doctors to be your doctors other than in emergency situations? Or do you need that nationwide plan that has doctors here in southern Wisconsin and northern Wisconsin and everywhere in between and across the nation, and even allows you to seek coverage out of network? One or the other likely will better meet your needs. There's also a health plan quality page on Employee Trust Fund's website that gives you ratings of previous participants, and that can help you decide, perhaps on previous experience, whether one plan over another might better meet your needs. And finally, very important, if you're choosing one of the Wisconsin-based plans, to choose a network that will be convenient for you to visit. There are some names of networks that are similar sounding to one another, but they offer very different ranges of where their doctors are located. So carefully choose the network based on what you find online through the health plan search or through the decision guide, so that you choose a group of doctors that will be convenient to visit for the rest of this year. Once you have made your decisions and have thought about the other supplemental plans as well, such as dental and vision and life insurances, you're ready to share your choices with us. And you'll visit the MyUW portal log in with your NetID and password, and then visit the benefit information tile, clicking that Enroll Now button. You'll then be taken to an enrollment portal that lists the various plans being offered to you, and you'll click into each of those types of plans, perhaps starting with health insurance, to make your decisions. The default for each is that you've waived them all, and if that meets your needs, then you could submit with everything having been waived. But assuming you want to enroll in various plans, you'll have to click on the health insurance, open it up, choose a health plan. Click on the vision insurance, open it up, and choose your vision insurance, and eventually then submit all of those choices to us by your deadline. The health section of the enrollment could look something like this. Everyone's view will be slightly different, but what I do know is that initially you will be having marked as waived the health insurance. So you'll want to go in and make adjustments to it if you don't want to waive the health. If you're going to select the nationwide access plan, then it should be kind of on the top of the list. If you're going alphabetically, look for the access-in-state version of the networks. And while it does say -in-state, that is the nationwide plan. So access-in-state and dental, if you want the preventive dental attached, would be the election if you want the nationwide coverage. Otherwise, if you're looking for a Wisconsin-based plan, you will have chosen which group of doctors will be your doctors for the coming year, and then look for that specific group name in the list of the available plans. On the screen, you see the select box is next to the Dean and Dental health offering. Also, here in Madison would be the GHC, South Central Wisconsin Dane Choice as a network, as well as Quartz UW Health. Those all have doctors right here in Dane County and here in Madison. If you must submit paper applications for your health election, you will find those forms right on our website in the health section. And while on the first page you fill out your name and your family's information, then as you move further into the application, you see a section that looks like this, where you'll mark no to the high deductible health plan, because that's not an option under the grad and postdoc benefits. But you do need to mark whether you want individual or family coverage, and whether you want the preventive uniform dental attached as part of your insurance. Choose with dental if you do want it attached, choose without dental if you do not want preventive dental coverage for the year. And then there will be a section where then you mark the actual group of doctors that will be your doctors for the year. Maybe that is the access plan with its nationwide network, or maybe it's one of the Wisconsin, smaller Wisconsin-based networks. Choose which is best for you, complete the rest of the form, sign and date, and make sure that your HR office receives the application by your 30-day deadline. And then watch for health cards to arrive in the mail at your mailing address. You should receive at least 2 cards, if not 3. So the first 2 cards, one would be from your medical network, whichever you chose, and you'd show that at your doctor's office or the emergency room when you need medical care. The second card will be from Navitus, which is what you'd show your pharmacy when you're filling a prescription. And then the third card would be provided to you by Delta Dental if you elected the health and dental option. So that would be the card you'd provide to your dental office if you're having your preventive routine cleanings and exams or your children's orthodontia. These ID cards are sent directly to you by the insurance company. So first you enroll, we send the enrollment information to the state of Wisconsin, and the state of Wisconsin alerts the insurance companies that you have enrolled. And it takes, because of that kind of train of information, as many as 4 weeks for you to receive your cards. Just in the meantime, be sure that your home address and mailing addresses are updated correctly in the MyUW portal. Let us know if you have any trouble receiving the cards, if you haven't received them after a month, and open your mail in the meantime. They often send these cards in unmarked, kind of plain envelopes to not alert anyone that there are health insurance cards inside. So open your mail until you've received, well, perhaps always, but definitely until you've received all of your cards. And if you do find that you need to seek medical care before you've received your cards in hand, or you need to fill a prescription before you have your pharmacy card, take a look at these next few slides. This is not an uncommon occurrence, and there are ways to work around not having a card in hand. So take a look at the presentation deck and let my office know if you have any questions. Next up, we have life insurance to discuss. And the reason I'm talking about life insurance is in part because this is a now or never election for most of our employees. You're being offered an opportunity to enroll now, but if you didn't enroll now, you may never be enrolled in the future. Why life insurance may be important is that life insurance can pay an amount of money to whomever you'd chosen as your beneficiary, whether that's one person or multiple people receiving a bit of the money, or even just a charity of your choice, should you die while being covered by that life insurance policy. And that could be very important to you if you are a member of a family where people rely upon you for important bills like mortgage or a car payment, or it simply might be important to you to ensure that the cost of your funeral wouldn't be all at the expense of someone else. Instead, if you're providing them life insurance that could help offset the cost of your funeral. If you do enroll in the life insurance plans, you'll want to submit a beneficiary designation form, and there is information about the beneficiary designations on our website. I would also anticipate you potentially being emailed by Securian, who runs the individual and family life insurance policy, so that you can actually sign up and list your beneficiaries on their website. Now, the individual and family life insurance offers you as a new employee the option to enroll in either a small amount of life insurance, $5,000, or you could choose $10,000, $15,000, or even $20,000 worth of life insurance. So as a new employee, that is your choice. If you choose coverage for yourself, you could also elect coverage for your spouse or your domestic partner or for your children. Or if you elect coverage for yourself now today, and in the future you are married or have a domestic partner or have a child born to you, then within 30 days of that qualifying event, you could add them to your already established individual policy. You can see on the screen the cost per month for a $20,000 election based on your age. It's not an especially expensive policy, but it is offering you this one open opportunity to enroll. As a new hire, you can elect. And if you do enroll in the coverage now as a new employee, then in the future, every fall, you'll be offered an opportunity to increase the value of the life insurance if you want to. You can increase it year after year after year, all the way up to $300,000 if you chose to do so, or you could always stay with a smaller amount that you elected as a new hire. But these increase opportunities are only offered to you if you sign up now as a new employee. They aren't offered as an open enrollment during the annual period. So think carefully about the individual and family life insurance. It is being offered to you now as a new employee within your first 30 days, but if you don't enroll now as a new employee, you have waived by default. And then if you've waived by default and you later are interested in enrolling, the only way to apply in the future is through evidence of insurability, which means a medical underwriting process has to occur. You have to fill out medical forms and provide them to the insurance company. Their underwriters will review your history and perhaps contact your doctor, and then they may, depending upon the results of your medical review, they may decide to deny your application. It's not a guaranteed way to get into the plan. So only as a new hire are you guaranteed to get into the life insurance if you sign up within your first 30 days. Now, there is also a University Insurance Association life policy that will be assigned to some of you who are watching this video. This is only applicable to our faculty and academic staff, some limited appointees who are not eligible for the Wisconsin retirement system, but who are eligible for these grad benefits and who earn enough per month to qualify for this plan. So in the future, you will be evaluated if you're faculty and academic staff and you make about $3,000 a month gross. You'll be evaluated to see if you are eligible for this UIA life insurance, and if so, you'll be assigned it at a future year. Each January, they reassess and reassign the coverage. If in a future year you are eligible for this plan, then they will charge you for the year's coverage. And currently the cost for a full year's coverage is $38.40. And this is something that they do automatically. It's not something that you enroll into or waive out of. It is part of your faculty or academic staff employment if you qualify for the coverage. Grads, postdocs, fellows, scholars do not qualify for this UIA life insurance. So your only option for life insurance would be the previous individual and family option. And you can read more about these life insurance details on our website. We also have a link through Securian where you can explore how much life insurance might be enough for someone. And if you're interested in receiving that link, either again, open up the PDF slides that are part of our website or shoot my office an email and we're happy to send you a copy of the link. Life insurance has its own start date. If you're signing up for the individual and family life insurance, its coverage would be effective the first of the month following 30 days of employment. So in the example on the screen, if your start date had been January 4th, your life insurance could be effective on March 1st, assuming we receive your application within your first 30 days. Right, next up, we have two plans to describe. We have the accidental death and dismemberment policy offered by the UW, and we have the accident insurance being offered by the state of Wisconsin. And you'll see them in the website under the life insurance section, but they are somewhat different than true life insurance because they only pay in the event that you were to be injured or die in an accident, not because of an illness, only an accident. So again, there are these two plans, one run by the university, the other by the state of Wisconsin, and they work differently. As a quick overview, the UW's AD&D policy is with a company called Zurich, and its primary payouts are in the event that you either die in an accident or are dismembered in an accident. So you lose your ability to see, your ability to speak, you lose a limb, those significant dismembering events for those who are covered by the AD&D policy could provide a benefit to them. On the other hand, the state's accident insurance can provide benefits even in the event that you were more slightly injured, not dismembered forever, but simply injured due to an accident and need medical care. But then even if you recover completely, the fact that you had an accidental injury is still cause for a benefit through that plan. I'll describe the UW's AD&D policy first. Again, it's with a company called Zurich. And the price you would pay to enroll in this AD&D policy depends on what level of benefit you want on your own life, and then whether you want the coverage just for yourself or whether you'll extend it to your family. You can have as little coverage as $25,000 on your life or all the way up to $500,000 on your own life. And then depending again on whether you want just coverage for yourself, it could be as little as 65 cents a month. Or if you want all of the coverage you can possibly get, and including your family, it would cost as much as $20 a month. And then what this coverage offers is in the event that you or your covered family member die in an accident or become dismembered, again, losing both hands, both feet, one hand, one foot, one limb, there would be different amounts of benefits paid out depending upon the type of accident that had been incurred. And if it were your family member who had been killed in an accident, the amount paid would be based on a percentage of coverage that you had on your own life. Now with Zurich, you have to remember, if you have the coverage, to file your own claims after those disabling events. And the request forms are available through their website, or you can give them a call if you have questions about making a claim through the AD&D policy. Also with the AD&D program, there is a travel assistance program that includes repatriation of remains. So for those certain of you who may be working under a visa that requires you to have a repatriation of remains insurance, this AD&D policy may meet your needs. There is also built into the enrollment an identity theft assistance program, and you can read more about these two kind of supplemental offerings that are part of the AD&D enrollment on our website. Finally, we also have the state of Wisconsin's accident insurance with the company called Securian. The cost you would pay to enroll in this accident insurance depends on who in your family you want to have coverage. And then the types of injuries that are eligible for, a benefit to be paid for you include dislocations, lacerations, x-rays, surgeries, the follow-up care that you might need following one of those events. Those could all be reasons to submit a claim to Securian because you were injured and needed to seek medical care due to an accident. The example that they share in their brochure gives you an idea of what it might look like if you were to incur a claim. In this example, there was an employee with a coverage who fell off a ladder. They broke their leg and their wrist. They had to ride in an ambulance to the emergency room, and they ended up staying in the hospital for 2 days. After all of that, they submitted their claims to Securian, and they received payments for each of those pieces of their trouble and ended up with a check worth $3,300. And that check is paid directly to the individual, so then that person can spend it on whatever they would like to. Maybe that helps them pay some of their medical bills, or maybe the insurance company is already taking care of those, so you could use the money for other things, like in this case, childcare or a dog sitter. It would be up to you. You do have to file your own claims with Securian. So if you are enrolled in the plan, remember that you have it and reach out to Securian if you ever have reason for medical care after an accident. Make sure you submit your claim. All right, next up, we have our supplemental dental insurance. I'd already introduced briefly the preventive uniform dental that can be attached to your health enrollment. But if you are in need of more major dental services like crowns and bridges, or if you need preventive dental but you are waiving health and you're looking for a standalone preventive plan, this is where you'd look on our website to learn more. The preventive dental insurance is available if you are waiving health insurance, but you still want insurance coverage for cleanings and exams. You would pay $36.10 a month if it's just you on that preventive dental plan, or you'd pay $90.28 a month if you're covering other members of your family on that preventive dental with you. And then if you want major dental coverage, again for crowns and bridges and oral surgery, either the Select or the Select Plus plan could be one that meets your needs. The Select plan is less expensive than the Select Plus, but the Select Plus offers more robust coverage, and we can see that on these next slides here. So under the columns, on the left-hand side, you see the uniform dental and preventive plans. They are identical. It's just that the uniform dental is attached to your health enrollment. But if you've waived health, you could still elect the standalone preventive plan. You can visit Delta Dental PPO and Premier providers. There is no deductible to meet before the insurance kicks in. It will cover 100% of your routine evaluations, twice-a-year dental cleanings, necessary x-rays, and your children's fluoride treatments. But that preventive and uniform dental does not cover crowns or bridges or implants or oral surgery, none of those more major services. And that's where the Select or the Select Plus plans come in. Under the Select plan, you can visit Delta Dental PPO providers, or if you choose the Select Plus, you could visit either PPO or Premier providers. Each of them would require you to meet a deductible before the insurance begins to pay for a remainder of the dental bills for that year. And then each of them has an annual benefit maximum, which is at most what they will pay per mouth per year. So the Select plan would require you to meet a $100 deductible per person per year, and that would pay 50% of the cost of a crown or an implant or your oral surgery up to $1,000. At most, it would spend $1,000 on your mouth each year. The Select Plus plan has its $25 deductible, and then it pays either 60% or 80% of the remaining dental bill, up to $2,500 per person per year. Also, with the Select Plus plan would be an orthodontia benefit that would cover half of an orthodontia bill up to $1,500 per that person's lifetime. And it doesn't limit the age of the person for that orthodontia coverage. So unlike the uniform dental and preventive plans, which do have ortho, but only for dependent children, the Select Plus plan could offer you as an adult some orthodontia benefit. Now, also with Delta is the vision insurance being offered to us through their Delta Vision group. The price you'd pay for the vision insurance per month depends on who in your family you're choosing to have covered. And then the actual coverage itself, if you're visiting one of their network providers, includes an annual routine eye exam. You'd pay $15 as your copay for that routine eye exam. And then if you needed materials, such as contact lenses or a pair of glasses, then you'd have an extra expense for those purchases. But a basic pair of eyeglasses could cost you a $25 copay. Or for contact lenses, they would give you $150 as an allowance towards the purchase of your contact lenses. Now, there are specific in-network providers that are best to visit if you're using the vision insurance. You'll visit the iMed Insight network providers, and you can see whom they will be on ETF or on iMed's website or by calling their member services line. There may be some benefits even if you go outside of that network. So if you take a look at those previous slides or at the pamphlet that describes the vision benefit, you can see that the out-of-network coverage exists in some cases, but it's not as high of coverage as if you'd simply gone to an iMed Insight network provider instead. So it was up to you on whether you want to stay within their network, which is recommended, or choose to be reimbursed for out-of-network services. Now, this last part of the presentation is specifically for our employees, such as student hourly employees, grad assistants, and certain post-grad trainees who are truly considered employees and paying, in many cases, employee taxes. It is not applicable to our non-service appointees. So that would be you potentially if you are a fellow, a scholar, our non-service grad trainees and interns, and most of our postdocs are fellows, scholars, and trainees. Because you are not considered an employee of the university, you won't be eligible for these upcoming retirement and pre-tax plans. For those who are employees and eligible to participate in the retirement programs, you can sign up for one or the other of these retirement plans and have money withheld from your paychecks, pre-tax or after-tax, and sent to be invested in the programs. So there is the UW's 403B and there is the state's 457B programs, and they are both open to you. You can enroll in one or the other or both in the same years. Each of them has a federal maximum over which you can't contribute within a year, but they don't cancel each other out. So if you made enough money to do so and wanted to do so, you could contribute $23,000 of your pay into the UW's 403B and another $23,000 into the state's 457B within the same year. There are various admin fees associated with signing up with these plans, and there are different rules about when you can take the money out, and you can read about that on our website. Just a note that if you have previous retirement plans from a former employer, you could roll that money from your former employer's account into the UW's 403B or the state's 457B programs. However, you first need to open the accounts in order for them to accept roll-in money. So that would be the place to start, is open the accounts. To open the accounts, there are different ways, depending upon whether it's the 403B or the 457. There is an easy enrollment form for the UW's 403B. You can find it on our website or through the link on the slides themselves. If you choose the easy enrollment form, send that over with either enrolling in Fidelity or TIAA, and the investment choices that are made on your behalf will be based on the age that you report being on the account, your date of birth. They'll choose investments based on how far you are from retirement. You can always make changes to those investment choices, but that is how it would be initially set up. If you want to be more hands-on, even with the initial setup of the investment choices, you could instead go onto the provider's websites. Through our website, we have links, and then either with Fidelity or TIAA, open accounts through the UW with them, and then to my office, submit a completed salary reduction agreement where you tell us, yes, you opened the accounts already, and here is how much money you want us to take out of your paychecks. You can always then change how much you have withheld from your checks. You can start and stop and increase and decrease your contributions throughout the year. Something similar is true for the state's 457B. It's just that you have to have a plan enrollment code to open your account, and you'll find that code in a pamphlet that we have linked on our website. They change the code on a quarterly basis, so you want to always use the most updated code if you're going to open a new account. And then you can either register on their website or call their member services line to get started with your account. And then once you have an account, you can increase and decrease and make changes to your benefits throughout the year. The other pre-tax account is the flexible spending account. And again, our fellows, scholars, non-service grad interns and trainees, and most postdocs are not eligible for this pre-tax account participation. For those who are interested and able to enroll in the flexible spending accounts, the company that is used with the state is a company called Optum Financial. The idea behind flexible spending accounts are that you can set money aside into these accounts without owing income tax, and then you use the money that's in those flexible spending accounts on only very specific purchases throughout the year. In the example on the screen, you see that someone who had earned $200 on their paycheck for doing their job may have only received $150 in their paycheck because income taxes were withheld off the top of their pay. But they could spend that remaining money on anything they wanted to. It's different with the flexible spending account, where if you sign up for one and the money you earn is sent to the flexible spending account, it's not sent to your paycheck at all. It is sent to the flexible spending account directly, but it is not subject to tax. So the full amount that you're sending to the FSA is there waiting for you, and it can be spent only on certain eligible expenses. These accounts are known as use it or lose it accounts because the money that you're sending into them have to be used by a certain deadline. In most cases, the deadline is the end of that year in which you sent the money to the account. So unlike your paycheck, where when you're paid money, yes, taxes are withheld, but then you can save that money or spend it immediately on whatever you want, the FSAs restrict how you spend the money that's sent to them. So the example on the screen shows someone sending $200 to a dependent daycare FSA. And in their case, they need to spend then that $200 out of the dependent daycare FSA to reimburse themselves for childcare expenses. If they don't, by the end of that year, they will have forfeited that $200. Now, there are two kinds of FSAs that you might elect as a grad or short-term academic staff or postdoc participant. I take that back, not postdoc in most cases. The health FSA can be elected for as much as $3,050 for 2024, and then you can use the money that you've sent to the FSA to pay for doctor's office visit copays, for the money you owe for, to meet a deductible or the out-of-pocket limit for the year. You can use it to pay for pharmacy benefits, even sometimes over-the-counter expenses like sunscreen and bandages. The dependent daycare FSA has a limit of $5,000 per household per year. So just to note that your entire household, if you are married, cannot contribute then more than $5,000. So if your spouse also has an FSA available to them, you have to figure out together who is going to contribute to the FSA and how much, because you cannot go more than $5,000 per household per year. The money that then is in the daycare FSA can be used to reimburse yourself for what you've spent to have a nanny or a daycare center watch your child while you were at work, or even to reimburse yourself for what you're paying for elder care expenses if you have a tax dependent who needs care themselves because they can't care on their own for themselves. They need someone to assist them with it. The flexible spending accounts have an online registration. After you've signed up through our portal, you would, once you're kind of set up in the system, also register with Optum as a new user. And you could also download their smartphone app. I would encourage that if you sign up for the FSA, because the smartphone app then allows you to check your account balances easily, and it also allows you to take snapshots of any documentation you might need to submit to the program proving that you were using the money in an allowable way. The FSAs are in effect the first of the month following your date of hire. Again, if your start date were January 4th, your FSA would then be in effect on February 1st. And you should check, depending upon your date of hire and when your FSA would begin, on how many paychecks you anticipate receiving, the first and second paycheck of every month, for the rest of this year. Because should you elect, $3,000 at the beginning of the year and you expect 24 paychecks, that's a smaller amount withheld from your paychecks per year compared to someone who is hired in the middle of the year and now is signing up for $3,000. By the end of the year, they still need to collect $3,000. So they will have to ramp up how much is coming out of each of your checks in order to make sure they collect whatever amount you had elected. You'll want to keep all of your receipts and explanation of benefits if you're signed up for a flexible spending account, because you must be able to substantiate your claims, meaning that you can prove to Optum or whomever asks to see proof. You have to be able to prove that the reason you're spending money from your FSA is a qualified reason. If you happen to have used your debit card on, at the dentist's office or at the pharmacy, and then Optum asks you to substantiate your claim, proving that the why you spent the money was an allowed reason, and you can't provide them with the documentation, then you will have to repay the account for the money that you'd spent that you couldn't prove was allowed. Or if you didn't directly repay Optum for the amount that you'd spent, then the UW would have to withhold the money from your paychecks and collect it back. Again, use it or lose it accounts. You have only a certain window of time to use the money that you have elected to send to your FSA. With the health FSA, you actually may have an additional amount of time, because as much as $610 from 2024 could potentially roll over into 2025 if you're still eligible for the benefits next year and you have enough in your account that it allows the rollover. But ideally, you are spending the money that you're sending to that account by the end of every year. And certainly the dependent daycare account, you want to spend the money that you're sending to it each year, because there is never a rollover on the dependent daycare FSA. The health FSA allows your election to be available to you as a pre-funded debit card. So if you were to sign up for $3,000 for your health FSA, when you receive the card and it becomes active, it actually has the $3,000 available on it. You could spend it initially up front, and then you just repay the account for the rest of the year with the money coming out of your paychecks and being collected. The dependent daycare account doesn't have a beginning balance. Not until you've actually had the money withheld from your checks is it then sent to the FSA, and then you see it there, and you can then reimburse yourself for what you had spent on childcare expenses. We also have some pre-tax transit and parking accounts available to our employees. Now, in many cases, our employees do not need these extra pre-tax accounts because you may receive what you need already through our UW Transportation Office. And let me point out the Transportation Office's information here. So here we have transportation.wisc.edu, their website. You can visit and learn more about bus passes that are available to employees at a highly discounted rate compared to the general public. There are also information about taxi vouchers. In emergencies, you can get a free ride home if you usually bike or bus or walk to work. And then there are pre-tax parking deductions available via payroll for employees who choose to purchase an annual base lot permit. Now, if these sorts of services aren't exactly what you need, take a look at the following slides that are part of the deck listed on our website and learn more about the transit and parking pre-tax accounts and see if one of those might better meet your need. For example, if you have flex parking through the transportation office, you might consider a separate pre-tax parking account as well. And that brings us to the end of this presentation. Just a quick reminder that should you expect to incur or actually incur a life event change, such as an addition of a new member to your family or the loss of a member of your family through to divorce or death, or simply a child who now has turned 26 and is aging out of the plan, let my office or your local HR offices know, because we will likely have information to share with you about how that affects your benefits options. Maybe it means a change to the benefits you currently hold, or maybe it means a new opportunity to pick something up that you hadn't previously elected as a new hire. Just let my office know when you're expecting those changes within 30 days of the change. Usually, once 30 days has passed from a marriage, for example, it will be too late to take action on that qualifying event. And here we are at an end. If you have additional questions about your benefits, take a look at our website and check in with your local HR contacts at hr.wisc.edu/contacts is where you'll find a list of the school, college, and division HR folk if you're not certain who to reach out to. Otherwise, again, my office, shoot us an email, benefits@ohr.wisc.edu. We're always able to assist if your local HR cannot. So welcome to the UW. We're glad you're here. We hope to get you set up with your new employee benefits quickly. Let us know if you have any questions, and take care. Bye, everybody.